Hi everyone, it's Jess from STL Fertility, one of the nurse coordinators. In this video, I'll be showing you how to prepare and administer Cetrotide. Cetrotide is a medication that'll get introduced a little bit later in your IVF cycle. It's a medication that actually blocks that hormone that tells you to ovulate. The first step in any injection is to ensure you have proper hand hygiene. To do this, you will want to use soap and water and then dry efficiently. At that point, you can then gather your supplies for your injection. For Cetrotide, you will need an alcohol prep pad, your actual Cetrotide kit, which inside the kit will have a longer needle for mixing, a shorter needle for your injection, a syringe with water inside of there, and your actual powder vial of Cetrotide. You will also need a sharps container. Take the longer needle and you will attach that to your syringe by twisting. You will then remove the cap to expose the needle. You will then grab your Cetrotide medication and with your thumb you will pop off the top of the vial. You will then take the needle of this and inject it into the hub. You can then squirt the medication of the water into the Cetrotide. You will then want to swirl to get it mixed and make sure it's all diluted. Once you have a clear consistency and the powder is all diluted, you will then rotate and invert this upside down and withdraw the fluid back into the syringe. Once you have all of the liquid back into the syringe, you can remove your vial and twist off your needle. The needle can then go into the sharps container. You will then take your injection needle and apply that to the top and twist that on. Now, to prime your needle and reduce any air bubbles, you will flick the syringe to get any air bubbles out and gently push on the plunger to push up until you see a drop of liquid at the top of the needle. We are now ready to administer your Cetrotide medication. To do a subcutaneous injection, you will do it to the left or right of your belly button, about 2 finger widths at the level of or a little below. The first step is to take your alcohol prep pad and you will clean the site in a rotating motion. Once your site is cleaned, you will take your medication, pinch your skin to expose the tissue, and inject the needle fully in at a 90-degree angle. You can then release your pinch. Gently push on the plunger until you have injected the medication fully. Leave in for a second or two and then remove the needle. You will then take the syringe and needle and place this in your sharps container. Thank you so much for watching this video. As always, if you have any questions or hesitations during medication administration, please ensure you reach out to your nurse coordinator.